Hello friends, welcome to a new lecture today on vesico-ureterial reflux. So what is vesico-ureterial reflux? It is one of the most common cause of urinary tract infections in children. So if you see, if this is the bladder and this is the urinary tract, if there is some abnormality, okay, because of some abnormality there is retrograde flow of urine from the bladder to the kidney. So here there is retrograde flow of urine. Okay, so this retrograde flow of urine is called as vesico-ureterial reflux. So this vesico-ureterial reflux is retrograde flow of urine from the bladder to the ureters and then pelvis. To the pelvis. Either it can occur at rest or it can occur during micturition. So this vesico-ureterial reflux is mainly of two types. It can be primary vesico-ureterial reflux and secondary vesico-ureterial reflux. In primary vesico-ureterial reflux is only the abnormality. There is no other abnormality which is there. Only there is vesico-ureterial reflux. In secondary vesico-ureterial reflux, it is associated with other anomalies of the urinary tract. Other urinary tract anomalies are seen in secondary vesico-ureterial reflux. So what are the risk factors for this vesico-ureterial reflux is a risk factor for acute pyelonephritis, or it can be a risk factor for complicated urinary tract infections. So one of the reason for this vesico-ureterial reflux is the presence of incompetent uretero. This is ureter. So ureterovesical valves. Incompetent ureterovesical valves can cause this vesico-ureterial reflux. Okay. So this vesico-ureterial reflux, there is retrograde flow of urine. So because of that, there is urinary stasis here. So because there is urinary stasis here, there is interstitial scarring, and sometimes there can be tubular atrophy. And this can at the end lead to secondary focal segmental glomerulosclerosis, because the nephron, if you see, if you see, okay, there can be, number one, tubular atrophy can be there. All the tubules may be atrophied. The interstitium, there can be scarring of the interstitium, and thus at the end leading to secondary focal segmental glomerulosclerosis. So in adults it can be asymptomatic most of the cases. So this is most common in children, if we have to say. So what are the how are we going to diagnose it? Okay, the diagnosis is by micturating cysto-ureterogram. Once you have done micturating cysto-ureterogram, you have 5 grades of this vesico-ureterial reflux. So what are the 5 grades of vesico-ureterial reflux? 1, there is vesico-ureterial reflux, but that vesico-ureterial reflux does not reach up to renal pelvis. The vesico-ureterial reflux is just up to the ureter. It does not reach the renal pelvis. So renal pelvis is completely normal. Okay. The second one, the vesico-ureterial reflux has reached the renal pelvis. Okay. Vesico-ureterial reflux, the urine, this has extended up to the renal pelvis. So this is the second grade of vesico-ureterial reflux. The third grade is the vesico-ureterial reflux has extended the kidney and there is mild dilatation of the pelvis, but there is no blunting of the pelvic calyces. These are pelvic calyces. These pelvic calyces are not blunted. They are sharp and pointed itself. But it has reached up to the pelvis, and even there is dilatation of the pelvis. Now what is that? Now it has dilated, and there is blunting of vesico-ureterial blunting of calyces is seen. But still there is one more thing which is there, and there is even moderate tortuosity of the ureter. One more thing is the papillary impression. If you see, this is the papillae are completely normal, and in the 5th stage even the papillae have been lost. Okay, even the papillae have been lost, and there is marked dilatation and there is marked tortuosity. So these are the different grades of vesico-ureteral reflux. So this is grade 1, 2, 3 and 4. So there are 4 grades for vesico-ureteral reflux. Now, how are you going to treat this vesico-ureteral reflux? The treatment of vesico-ureteral reflux is mainly based on the grade. If the grade is 1st and 2nd, then you give cotrimoxazole or nitrofurantoin. Okay, if the grade is 1st and 2nd, you can give cotrimoxazole and nitrofurantoin, and the prophylaxis is given for 1 year. If this is for 1 year. If there is 3rd, 4th and 6th, you will give the same drugs, but you give it for 5 years. So that is the major difference. So that major treatment is, if it is type 1, type 2, you give, in all the cases you give cotrimoxazole or nitrofurantoin, and you give, if it's type 1, grade 1 and grade 2, you give it for 1 year, prophylaxis for 1 year. If it's grade 3, 4, 5, you give the prophylaxis for 5 years. So this is about vesico-ureteral reflux. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.